Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case study that highlights the challenges and triumphs in treating a service dog's acute environmental fears. This is especially important because service dogs require significant investment in time and money to train and maintain. Moreover, the emotional bond between a service dog and its handler presents unique challenges when behavioral issues arise. Removing a service dog from duty can be emotionally taxing for the handler. Our story begins with a 3-year-old English Golden Retriever named, who suddenly developed intense fears of various environments. These fears were so severe that they began to interfere with her ability to perform her duties as a service dog. She was trained to assist her handler, a 16-year-old girl, by interrupting repetitive behaviors and helping to manage panic attacks. To do this, the dog had to be comfortable in a variety of public settings, including her handler's school. Initially, the dog had displayed mild fear around small children, but this did not impede her work. However, at the age of 2, after a year of service, she began to exhibit new anxieties. The handler first noticed the problem at a groomer inside a large store. While the dog confidently entered the store, she became distressed on the slippery tile floor, trembling and refusing to walk. Over the next few months, the dog's anxiety escalated, particularly at the handler's new school. The bright environment, with its many windows, multicolored tile floors, and reflective walls, seemed to exacerbate her fears. She hesitated to walk normally in hallways, sticking close to the walls, and resisted using the stairwell, which was surrounded by large windows. The dog also refused to enter the elevator unless she was carried. Even high-value food treats could not entice her into these spaces. Once on carpet, the dog's fear diminished, and she could perform her tasks. This pattern of behavior was consistent throughout the school's uncarpeted areas, but louder environments like the cafeteria did not worsen her anxiety. In addition to these issues, the dog developed a fear of the school bus, trembling and refusing to board. The bus driver's attempts to alleviate her fear by turning off the engine before she boarded were unsuccessful. Even once on the bus, she remained tense and hypervigilant. Eventually, the owner had to drive the handler and dog to school. The dog also began to show fear when approaching new doorways or thresholds, regardless of the flooring. As time passed, the dog's fears extended to her home environment. She became anxious around thresholds to previously closed-off rooms and avoided the tile and wood floors. She detoured around bright, sunny spots on the floor and the tile flooring near the fireplace. Interestingly, her fear decreased on cloudy days or when the tile was covered. By the time of the initial consultation, the dog had been experiencing these fears at school for 2 months. Her inability to accompany her handler to school led them to consider retirement. During the physical examination, the veterinarian noted salivary staining on the dog's paws and vulva. When approaching the hospital door, the dog attempted to retreat, mirroring the behavior observed at school. Inside the hospital, she trembled upon stepping from carpet to tile and had to be carried to the examination room. To reach a diagnosis, the veterinary team considered several possibilities. These included generalized anxiety, nonsocial environmental fear, fear of surfaces due to orthopedic pain or neuropathology, and photosensitivity from an ophthalmic disease or neuropathology. Slippery surfaces can cause anxiety in dogs due to a loss of traction and stability, leading to a perceived traumatic experience. Medical issues, such as orthopedic pain or proprioceptive deficits, can also intensify frightening experiences. The examination revealed no orthopedic or neurological abnormalities, though the dog had slightly overgrown interdigital hair, which might have reduced her traction. The team also explored the possibility of a primary ophthalmic disease causing light sensitivity. Differentials included glaucoma, corneal ulceration, neuritis, and uveitis. However, the dog's normal visual status and the progression of her fear ruled out sudden acquired retinal degeneration syndrome. The dog's eyes appeared normal during the examination, with intact reflexes and no aversion to bright lights. Consequently, a full ophthalmic consultation was declined. The veterinary team considered photophobia associated with migraine-like episodes. The dog did not exhibit signs of nausea or pain-related vocalizations. In humans, photophobia can be linked to migraines, epilepsy, traumatic brain injury, and other neurological abnormalities. Classical conditioning can also create fears of neutral stimuli. If a neutral stimulus is followed by an unpleasant experience, the dog may associate the stimulus with fear. The dog's lack of fear on non-reflective surfaces suggested that the reflected lights on shiny floors and mirrored walls were predictors of slippery surfaces. Based on these findings, the team diagnosed the dog with nonsocial environmental fear and generalized anxiety. The frequent and unavoidable exposure to potential triggers contributed to the diagnosis of generalized anxiety. Given the complexity of the case, the owner sought a specialist consultation to explore treatment options before considering retirement for the dog. The treatment plan focused on the welfare of both the dog and the handler. The initial approach involved avoidance, environmental management, and behavioral medications. The plan was to start behavior modification once the medications had reduced her fear. The primary goal was to enable her to perform her tasks reliably while maintaining good welfare. The prognosis was guarded due to the likelihood of needing lifelong management, the importance of maintaining the dog's welfare, and the uncertainty of a full return to work. Retirement was considered if her welfare remained compromised. The initial environmental adjustments included covering windows, placing a blanket over the tile near the fireplace, and trimming the interdigital fur to improve traction. Because the dog was unable to participate in training exercises in frightening environments, medication was necessary. Serotonin's role in mood regulation and fear processing is well documented. However, she still took longer routes to avoid the wooden floors. To further improve the dog's emotional response, systematic desensitization and counterconditioning were implemented for the elevator and the middle of the hallway. Response substitution, using operant counterconditioning, was recommended to change the dog's behavior and create positive associations with the stairwell. Then, the handler used a touch cue to encourage the dog to take a few steps away from the wall, rewarding her with a treat. The handler gradually increased the duration and distance the dog could stand away from the wall, rewarding her for remaining calm and relaxed. Selection as a service dog does not guarantee immunity to fear and anxiety. Fear and anxiety can manifest as freezing, retreating, or aggression, all of which interfere with a service dog's ability to work. Despite efforts to predict behavioral phenotypes, undesired behavior remains a common cause of early retirement or training failure. While the benefit of a service dog to its handler is undeniable, the dog's welfare should also be a primary concern. Assessing and treating fear and anxiety in service dogs is crucial for preserving their function and ensuring their well-being. Behavioral treatment for service dogs mirrors that of pet dogs, with a few key considerations. Behavior modification is essential for sustainable improvement, and antidepressant medication can supplement this. Medication alone is insufficient without environmental management and behavior modification. To date, there are few published cases of these medications being used in service dogs for generalized anxiety and non-social environmental fear. Fluoxetine was selected for this dog due to its effectiveness and mild side effects. Somnolence or lethargy could impair a service dog's ability to perform its tasks. The veterinary formulation of fluoxetine was chosen for its standardized formulation and bioavailability. While generic fluoxetine can be effective, the variability in concentration could lead to inconsistent results. Although medication and avoidance were the initial focus, the dog returned to school earlier than planned. Despite improvement, she still showed some aversion to frightening stimuli. Removing a dog from work to practice avoidance can be challenging. Fortunately, the team was able to work with the dog before the handler returned to school. Without behavior modification, the dog might have regressed. Without appropriate behavior modification, negative associations can be relearned over time. However, the team was able to implement behavior modification soon after, creating new positive associations and changing the dog's motivation and behaviors. In conclusion, this case demonstrates a straightforward treatment plan for a service dog with generalized anxiety and non-social environmental fear. Before fluoxetine, the dog was unable to participate in training or perform her job in stressful environments. Pharmacologic intervention was necessary for successful treatment. This plan can be applied to other service dogs with similar issues. The dog's emotional welfare should always be considered, and frequent reevaluation is essential to determine if the dog should continue working. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.